what foods do the diabetics have to take? Yes, this is, I think, the biggest ever question. Everyone have this in mind, all of the world. Yes, people have to understand. I think of late, for the past 5 to 6 years, or maybe in a decade, what I have noticed, the interest, the enthusiasm what people have developed over food in treating every possible disease, I think it is immense. Yeah, agreed. Actually, once awareness towards understanding disease is appreciable, but at the same time I feel if you can treat every disease with only food, that will be the greatest answer available on the world. Not like this. Yes, as I was telling, diabetes is a spectrum. If you are in the initial part of the spectrum, maybe we can treat your entire diabetes only with food. If you crossed that spectrum, maybe we need changes in diet as well as changes in your physical activity. Maybe you crossed that also, then we have to go with the help of medications, either with oral hypoglycemic agents, I mean oral medications, tablets, or if necessary insulin also. Now coming to the food, so when people ask me, doctor, what should I eat, what is the diet you recommend for my diabetes? Yes, try not to have all exotic foods which is not available in your locality. Diabetes can be treated simply by not selecting a specific food. I rather tell it as, it's not what you eat, it's about how much you eat. See, as long as you are having a healthy food, as long as you are having a home cooked healthy diet at home, try to decrease your quantity. For example, a lot of people ask me, the moment they are diagnosed as diabetes, they immediately tell, doctor, I started having chapati. No, if eating chapati is going to decrease your diabetes, for all practical purposes, upper hemisphere, I mean the northern part of the country, completely, who are more dependent on the wheat as a staple food, none of those people should have diabetes. Yes, compared to chapati or the wheat, rice has got high glycemic index, of course. So you have to, I rather tell, cut down your rice, I mean stop eating rice. I rather tell, cut down your rice, cut down the portion of carbohydrate in your meal and increase the protein and increase the fat content. Preferably increase protein, increase fiber. So always divide what kind of diet are you having and how much are you having. So quantify your meal. If for a diabetic patients, we try to give, if they don't have any other problems, 1500 to 1800 kilocalories is what we recommend in a day. So now try to choose your meal according to that. A typical South Indian sumptuous meal, if we attend for a buffet party, our calories is going to be anywhere between 900 to 1500. So one meal we are going to relish the buffet, the calories is nothing less than more or less 1200 kilocalories. So a doctor recommends you to have altogether 1500 to 1800 kilocalories in a day. We have one single meal, that too preferably, most of our parties are in the evenings or the nights, we tend to consume very significant. So you have to watch on your calories. Now many of the times when I say diabetes, people always check their fasting and blood sugars in the morning. Your fasting and blood sugars are normal, like 120, 125, and but when you check at your average, 3 months average, their HbA1c is 8.5 or 9. So this is a typical example of, we usually have an optimal breakfast in our country, we have a reasonable lunch and a heavy dinner, I think, but we never check our sugars during the lunch or during the dinner or the night supper. So someone has to have a check on their meals in 3 different times in a day, so that they'll understand how far they're keeping their blood sugar under control. So as I was talking about what to eat, any food substances with high fiber, with low carbohydrate should be your choice of food. In case you are comfortable in having rice, try to have a rice which has low glycemic index like brown rice. If you are not comfortable with having brown rice, you can have rice only, but minimize the portion. And other important trick in controlling diabetes is have small frequent meals. Instead of having 3 large meals in a day, have 5 to 6 small meals. In simpler sense, when you're having your breakfast, when you're having your lunch and dinner, try to cut down 30% of the portion in your regular meal, and have your snacks with a gap of 2.5 to 3 hours from the meals. So for example, if you're having a breakfast at 8:30, try to have a snack at 11 o'clock or 11:30, which could be an apple, which could be vegetable salad, which could be a cut fruit, which could be cooked peas, which could be sprouts. Similarly, once you have lunch at your 1 o'clock or 1:30, you can have one more snack at 4:30 or 5 p.m. So when you space your meals and reduce the quantity what you eat, you definitely are going to get the best advantage of dieting. Instead of searching for an exotic foods, please try to have your homebound food with limited quantities. And other important thing, so what we have noticed, people, just because you are available, you are in city, just because lot of exotic foods are available, so we have a habit of getting all those things which usually not been seen a decade ago. So every food, every kind of food is always expected in that particular region where the people belong to. For example, Middle East food or Mediterranean food, or all these foods are staple foods, or they're set in foods for that particular region or locality or their lifestyle. So our lifestyle is different. So try to stick on to your native foods, only that you have to decrease the quantity what you take and increase your physical activity. So physical activity, particularly yoga, walking or jogging, is going to help you, as well as a good sleep. An adequate sleep of nothing less than 7 hours per day is going to help to reduce your diabetes.